Madam Chair, we are now live.
Good afternoon, everyone. It is 1 o'clock straight up on April the 8th, and so we will call the meeting of the Public Employees Benefits Program Board to order. With that, staff, I will ask you to call the roll.
Thank you. Laura Freed.
Here.
Linda Fox. I don't see Linda. Betsy Aiello.
Present.
Don Bailey.
Here.
April Caron.
Present.
Michelle Kelly.
Here.
Jennifer Krupp.
Here.
Tim Lindley.
Here.
Marcia Urban.
Here.
And Tom Verducci.
Here.
Thank you. We have a quorum.
Thank you very much. All right, let's go to agenda item 2, public comment. Reminder, no action can be taken on a matter raised under public comment unless it's included on a future PEB board agenda as an item on which action might be taken. Public comments to the board are always taken under advisement but are not answered during the meeting, and we will limit the comment of each caller to 3 minutes. So with that, I'll turn it back to PEB staff.
For those who have joined for public comment, your name or the last 4 digits of your phone number will be announced, and you'll be advised that you may now make your comments. If you're calling in via telephone, please press *6 to unmute. Due to time considerations, each caller will be limited to 3 minutes. Caller with the last 4 digits, 7338. Please slowly state and spell your name for the record, and please press *6 to unmute.
Good afternoon, Chair Freed, members of the board. This is Priscilla Maloney with the AFSCME 4041 retirees. Can you all hear me today?
Yes, we can hear you.
Thank you. The AFSCME retirees would just like to speak to the agenda item regarding the bill tracking list that the board will be reviewing today, and say that we are in support of SB 360 for the record, and we agree with some of the written testimony that's already been filed as exhibits from AFSCME 4041 members. We agree that we need more involvement and input from rank and file employees who are in fact PEB members, and SB 360 accomplishes that goal. So we would urge the board today to please support SB 360 and to vote on that position, and thank you for your time and attention to this.
Caller with the last 4 digits, 8725. Please slowly state and spell your name for the record, and please press *6 to unmute. Caller with the last 4 digits, 7111. Please slowly state and spell your name for the record, and press *6 to unmute.
Good afternoon, board members. My name is Janelle Woodward, JANELLWOODWARD. I'm a state employee and member of AFSCME Local 4041. We would ask the PEB board to support SB 360. I appreciate everything the current PEB board has done. You all have worked tirelessly in the work of this session. However, for too long, rank and file state employees have lacked having a say on issues that affect our lives, our working conditions, and the services we provide. There need to be board members that can relate to the 90% of the state workers who are not at the top of the pay grade. We need to have a say in our health care because management does not always know what's best for workers and our families and cannot always relate to the average worker. Having an organization that represents thousands of state employees provide a list for the governor to choose from ensures far greater input from workers than the governor, not picking on this one, continues to get to choose board members with no assurance that it's someone who will speak for thousands of workers and their families. While it's about money, it is not only about money. I do hold an advanced degree, but simply having a degree does not ensure a person can understand the insurance industry and how it works. Please do not look down on those who do not have advanced degrees and think them unable to understand the inner workings of health insurance. We appreciate that most PEB board members do their best to make the best decisions for the thousands of state employees enrolled in PEB health insurance plans, but good intentions do not replace our actual lived experience. Thank you again for all that you do. Thank you.
Caller Kent Irvin, please slowly state and spell your name for the record and make your comment.
Okay, this is Kent Irvin, E-R-V-I-N. Sorry for that, I had to unmute. Kent Irvin for the Nevada Faculty Alliance, the independent association of faculty at NSHE colleges and universities statewide. We work to empower faculty to be fully engaged in our mission to help students succeed. Being fully engaged means not spending excess time and money on health needs because of diminishing benefits for state employees. Regarding the bills being considered today, we recommend neutral positions on most. Where there are fiscal notes, those speak for themselves, and the policies are up to the legislature. We do oppose AB 337 and recommend that the board oppose it because it may require PEB to operate a standalone clinic at great expense and uncertain return on investment, and mainly because it impinges on PEB's ability to do its duty to set plan design as fiduciaries for participants. We support SB 360, which changes how the PEB board nominations are handled. SB 360 does not change in any way the number of board members or the groups that they represent. The practical effect of SB 360 is that it will require that multiple nominations be submitted by the various constituents groups rather than just allowing recommendations. The board may wish to take a position in support of stronger representation from all the groups. Finally, SB 373 is a bill to establish collective bargaining rights in statute for certain state employees, primarily NSHE faculty, similar to those for state classified employees and local government employees. We strongly support this measure. At the hearing last night, Executive Officer Rich and Director Freed put very large fiscal notes on the record totaling $3 million on SB 373. We at NFA have not yet had the opportunity to review the fiscal notes. They were not posted, so we are at a loss as to how they were calculated. In any case, it is not the intent of SB 373 to require any changes to the internal operations or plan design at PEB. We look forward to working with PEB and the Department of Administration to remove the fiscal notes. Thank you.
Caller Carter Bundy, please slowly state and spell your name for the record and make your comment. Caller with the last four digits 0237. Please slowly state and spell your name for the record and press *6 to unmute. Caller with the last four digits 8725. Please slowly state and spell your name for the record and press *6 to unmute.
Hi, my name is Stephanie Parker, STEPHANIE, last name Parker, Parker. I am a proud member of ASME Local 4041 and a classified state employee. And I am in support of SB 360 and ask you to support it as well. This will enhance the makeup of the appointees of the PEB board to include ASME representatives as well as for classified employees, as well as higher education. The past few years, I've been monitoring PEB board meetings, and I appreciate the work that this body has continued to perform, but it has been evident that there has been a lack of input from most of the population that the program is intended to benefit, classified employees. I applaud this effort to provide for the inclusion of classified employees as representatives of labor. I know that representatives will have working knowledge of the impact that changes will have on our participants and will be equitable in ensuring that we maintain a viable plan. As a classified employee, and may I add that I don't have a degree, I have had the honor and pleasure since 2011 of being appointed and serving on a couple of state boards and committees. And I've done so effectively, having a vested interest in Nevada, child safety, and providing equitable and objective processes for employees, and my personal and professional experiences have supported my credibility. I know that you will agree that there is a benefit to enhancing the makeup of this body for the good of all. I urge this body to support this bill to add to the cadre of knowledge and stakeholder input from the vast majority of participants that will ultimately enhance and improve the PEB program. Thank you.
Caller Doug Unger, please slowly state and spell your name and make your comment.
Doug Unger, D-O-U-G-U-N-G-E-R, President, UNLV Chapter, and Southern Nevada Government Affairs Representative, Nevada Faculty Alliance. I would like to support SB 360 because it will expand representation and expertise on the board without changing the nature of the board in any way. And I would also like to express opposition to AB 337, the standalone clinic, which we believe is will be expensive and a bit outside the purview of PEB. Regarding agenda item number 3 and Senate bills, we wish to state for the record regarding Senate Bill 373, collective bargaining for certain public employees, that there should be no financial note whatsoever to PEB for this current biennium should the bill be passed as written. And we have also prepared a conceptual amendment that will remove any conflict with NRS 284 or 287. So we request of the board at least neutrality or consideration that this is ongoing legislation which will remove any potential financial note to PEB. Please also know that collective bargaining units are already set for our community colleges, and any renegotiation of these would be merely an extension of the existing collective bargaining units that pertain to the Board of Regents and NSHE. So PEB would be left harmless and without any financial note. And for both UNLV and UNR, the collective bargaining units would clearly take at least 1 year or longer to set up. So any negotiations that follow would address the 2023-2025 biennial budget, not the current one, with the state professional employer, the Board of Regents and NSHE. So PEB would be an administrator for the state and not a party to any negotiations. We envision a scenario in which PEB health insurance and benefits serve as a base plan, with supplemental and/or augmenting coverage or compensation add-ons negotiated through NSHE and our colleges and universities, with any RFPs secured independently of PEB or internally through the UNLV and UNR medical school clinical practices as they grow, so as to maintain the competitiveness of our institutions for hiring and retention. Current PEB plans now leave the higher education system in Nevada with substandard health insurance and benefits compared to peer and aspirational institutions nationally. Hiring and retention issues contributed to by these substandard and non-competitive PEB plans carry a very high cost to our institutions through increased employee attrition, expensive training, and disruptions to stability. Faculty of the state of Nevada deserve the fundamental right in any case to advocate for health insurance and benefits through the Board of Regents and our higher education system. We further assert to the board chair, Freed, that there should be no significant financial note whatsoever from SB 373 to the Department of Administration, as SB 373 clearly designates our individual institutions as the, quote, state professional employer, and thus subject to tasks and approvals entirely under the authority of the Nevada System of Higher Education and the Board of Regents. Nevada faculty are not classified staff. The NSHE system and Board of Regents already have in place the administrative and legal infrastructure to engage in collective bargaining without any but the most minimal financial impact on the operations of the Department of Administration. Thank you for your consideration, and thanks to all on this board for your service and dedication.
Caller Carter Bundy, please slowly state and spell your name for the record, and you may make your comment.
This is Carter Bundy. Can you hear me now?
Yes.
Great. I apologize before. CARTERBUNDY, registered lobbyist with AFSCME for the record. We want to thank the PEB board and echo others' comments. We know how hard all of you work, and that's a significant commitment of time, and you all care about state workers and others who are covered by PEB. We do encourage you to support Senate Bill 360, though. As others have said, there's real value to diversity of lived experience, and we have a lot of members who are getting by on $30,000, $35,000, $40,000 a year, for whom some of these decisions, how the cuts are made, what benefits stay and go, might be very different from those of people who are currently on the board. So we think diversity of lived experience is an important part of running a good board, because the board is there to help state employees. And the second point I want to make is that this doesn't change the composition of the board whatsoever. And in fact, we think it really it closely hews to the intent. If you look at NRS 287.041, the groups, the NSHE, the retiree, and the state classified appointees are supposed to be appointed by the governor upon consideration of any recommendations of organizations that represent state employees, in our case. That consideration hasn't really been taken seriously over the last 20 years, and we certainly are not singling out this governor. Over the years, we have made numerous suggestions, submitted many names to different governors, and we have had exactly one appointed. So we think that the current system isn't reflecting the intent of 287.041, and we hope that SB 360 will rectify that, and we look forward to working with the PEB board as this bill moves forward. Thank you.
Caller Peggy Bond, please slowly state and spell your name for the record, and you may make your comment.
Good afternoon. My name is Peggy Bowen, P-E-G-G-Y, B as in boy, O-H as in Howard, N as in Nancy. And in an effort to save time and energy, I want to agree with those who have spoke before me, and I am also in support of SB 360. Thank you all for what you do, and have a great afternoon.
Caller with the last four digits, 4515, please slowly state and spell your name for the record, and you may make your comment. Caller with the last four digits, 9851, please slowly state and spell your name for the record and press *6 to unmute. Caller with the last four digits, 0699, please slowly state and spell your name for the record and press *6 to unmute. Caller Agnes Galvez, please slowly state and spell your name for the record, and you may make your comment. Madam Chair, that concludes the public comment section.
Okay, thank you very much. With that, we'll go to agenda item 3.
All right, for the record, Laura Rich, Executive Officer. I think if it's okay with you, Chair Freed, I am not going to go over every single one of these bills. I think, in the interest of time, I think we can really focus on some of the bigger ones, especially the ones with the fiscal notes. But if there are any board members, perhaps at the end, who would like to single out any, I'm happy to go back and discuss any of these. So as long as we're all okay with that, I will move forward with that approach.
I'm okay with that approach. I just want to note that Linda Fox has joined us. Thank you, Vice Chair Fox. Ms. Rich, can I clarify one thing? This is a 33-page document, I believe. So this is a cumulative listing of everything that we discussed at the last legislative update meeting, as well as new stuff that's been added since then. Am I right?
That is correct. Yes.
Okay, great. So the stuff we discussed last time, we can probably skip over unless a board member chooses to go back to it, which is perfectly fine. But with that, okay, I will turn it back to you to discuss what you view as the salient bills for PEB.
Okay, so the first one, if we look at page 3, which is AB 48, I did want to touch on this one because it is the PEB bill. There have been no changes to this since the last time that we discussed this last month. It was passed and out of committee, approved out of committee, and is waiting to be heard in the Senate. So hopefully we'll have an update on this one soon, but I did just want to touch on that one. The next one, let's see, I'm going to go through these pages here. I've got them all identified. The next one is on page 9 of 33, which is AB 250. This one, although it does not have a fiscal impact to PEB, I wanted to make sure to bring this up to the board and to just highlight it because it does impact our Medicare Exchange members. I sat through the hearings on this just to better understand what was occurring and what was the goal of this legislation. It actually has a positive impact on Medicare Exchange members because the legislation proposes that Medicare retirees who have those supplemental policies are now subject to, or they're able to change plans during a special open enrollment period that is defined as a 60-day period of their birthday month. So I think this is a good legislation for those members that are in the Medicare Exchange that do have Medicare supplemental policies. It does not really affect the program per se, but it does affect our members. So I just wanted to highlight that one. So I will stop there for any questions related to AB 250.
Board members, I'm not hearing any questions. This is Laura Freed for the record. Okay, I guess let's move on then.
Perfect. So the next one is on page 11 of 33, and this is AB 274. This bill mandates certain fertility services that are currently not covered under the plan. The fiscal impact here is relatively low. We're looking at $71,000 over the biennium. The utilization in this type of benefit is actually really low in our plan anyway, but there was a conceptual amendment that was proposed that allows PEB and other self-funded plans to opt in, or either opt in or opt out. I'd have to look, but it makes it a may versus a shall. So if that amendment is, if it's passed with that amendment, then it should remove the fiscal impact of this this bill. So I'll stop there for questions. All right, doesn't sound like there's
Actually,
any.
I'm sorry, I couldn't get off. It's Michelle here, Executive Officer Rich. I just, excuse me, I think I'm bringing this up now because I just generally have questions about the fiscal notes. I don't really know how that works, and I would like to better understand exactly how you guys develop your fiscal notes and what assumptions you use, and then you know, how you test for that as well, how you test the accuracy, I guess.
So that is a very good question, Laura Rich, for the record. So we heavily rely on our vendors to develop these fiscal notes. So whether it is our third-party administrator, whether it is the actuaries who develop the projections, or sometimes it's also, if it's pharmacy related, it will be related to, so Express Scripts would provide those numbers. And what they do is I provide them, or we provide them, the bill language specifically, and really start to, we identify any of these sections that we as staff have identified as potentially impactful to the program. And when I say that, sometimes it's the PBM, sometimes it's the TPA. It could be all three of them, right? It could be the actuaries, the TPA, and the PBM, depending on what that bill entails. And so this is shared with, you know, the group of vendors that would be able to provide that information to us. So in this situation, what we did is we shared it both with Healthscope Benefits and Aon Consulting. And what they do is they look at, okay, what does the utilization look like? And they also compare it to other books of business and things like that. And they're really the ones that come up with, this is what we think it would, the impact would be based on, you know, all of these different factors. So it's different on each one of these bills. It's different, different players in that, in the methodology, and it just depends on the bill and what is being projected. So in this situation specifically, we reached out to Healthscope and Aon, and together they looked at the utilization and they made projections on, based on if these services that are not covered today, if they should be covered later on in the next plan year, then what kind of impact would that make? So Healthscope looks at, well, what do these services cost? And Aon looks at what is a realistic utilization of these services. So hopefully, does that answer your question, Ms. Kelly?
Yes, I think it does. So just a quick follow-up. So in the methodology there, I assume if things aren't covered by PEB, then in some way they have to use kind of generally available prevalence in the community of a particular condition and whatnot. Is that right?
That is correct. So, and I think we do have someone from Healthscope on, but I believe in most of these cases, what they would do is, again, look at their book of business and look at what the general pricing is of those services that are not covered by PEB today. And they would then apply those to the utilization happening in our plan. So for example, you know, what is the utilization in other books of business? And then also, you know, how does that compare to the experience that PEB has for those benefits overall? So, you know, how many people are using fertility services? And so because of this, we have a relatively low population using those to begin with. I don't know if that's generally across the board or just in our plan. But they they could see that, okay, there's a, this is what the services would cost should those services be covered under the PEB plan, and then they apply it to the utilization of those people that are currently utilizing fertility services.
Thank you. I appreciate your taking the time.
Listen, Tom Verducci for the record, just as a follow-up question, I see a note here under the fiscal note, and we have an asterisk that reads, conceptual amendment will remove fiscal note. And Laura, I think you mentioned that already, but could you expand just a little bit on that? Is the fiscal note indeed going to be removed here, the $71,000?
So that was, for the record, Laura Rich, that was a conceptual amendment that was proposed. I believe if this bill does move forward, it sounds like there's a good chance that this amendment will make it into, into the bill because of there's a desire from the bill sponsor to, they realize that there could be a financial impact on those self-funded plans, especially in a time where we are dealing, with the pandemic and the costs associated with the pandemic and the unknowns of the pandemic. So there was a desire to incorporate the ability for self-funded plans to opt out of that or opt into it. I don't recall right now which one it was, but essentially it gives self-funded plans the option versus a mandate. So that has not been it has not been heard in a work session yet, and so that bill is still waiting to be heard. And I don't think it's scheduled. I don't see it scheduled for anything this week. So we will watch.
Thank you.
Tim Lindley here. I just wanted to thank Member Kelly and Director Rich for clarifying on how the fiscal notes are generated. Thanks.
This is Laura Freed. I just wanted to note that this fiscal note isn't larger because PEB, in comparison to other public plans, is actually fairly generous about covering fertility treatments. I've had PEB participants with fertility issues actually approach me and say that part of the reason they appreciate working for the state is because they've had those problems and they've been able to get more things covered than they would have if they worked at another public entity or in the private sector. So.
Okay, can we move on to the next one? Or are there any more questions on that one? All right, looks like we can move on. The next one is on page 12. I wanted to cover AB 337, which those of you who were listening to public comment, there was some public comment regarding opposition to this. This bill would require the board to create a certain pilot program in certain circumstances. So the pilot program is intended to be for a near site clinic, which those of you who have been on the board for a while, in 2017, PEB actually explored this option, and we had some challenges with it. We put out an RFQ, a solicitation for a near site clinic, and we required in that solicitation very clear return on investment language and proposals. So we did receive 3 proposals in that situation, and only one of those proposals was able to agree to PEB's requirements on ROI. That cost proposal submitted by the winning vendor came in with $1.3 million of implementation startup costs, $3.56 million in year one of operating expenses, a little over that 3.67 million in year two of operating expenses, and then it just goes up from there in year three to 3.78 and 3.98 in year four. So the solicitation ended up getting canceled because we realized that it wasn't right for the program. Not only were we not able to guarantee savings in this type of project, but there were some other challenges too, meaning, where do you put this? Where do you put this clinic? So this makes sense in a situation where you've got a company with a large campus, similar to maybe IGT. You've got all their employees on one campus. You have an employee sitting in their office at 3 o'clock that can walk over to their clinic at 3:15 for their appointment. That works out really well, and it's very convenient, and you probably can drive savings because you are driving your entire population there. In the state, it doesn't work that well. In the state, we've got very dispersed populations and dispersed office buildings as well. So really the only place that we have a conglomerate of offices is in Carson City. This really isn't needed in Carson City. I think that if anything, it would be a more appropriate placement in Las Vegas. But in Las Vegas, there's not a centralized location where you can drive folks there. Additionally, primary care just it's not a cost driver. It's not somewhere where PEP spends a lot of money, and it is not somewhere where we're going to see a lot of cost savings. And so it's really what you're trying to do here is deliver a convenience for your population, and then also encourage them to seek that primary care. Again, that works very well if you are in a campus type organization, just not so well for a very diversified state like the state of Nevada. So we did place a very significant fiscal note on it. It's about $7.5 million. This was presented on March 29th, and it is due for it's on the agenda for work session tomorrow at 8 a.m. So we will be watching that very closely tomorrow. With that, I'll stop for questions.
Oh, yes. Tom Verducci for the record. What I wanted to ask here is, in the past, PEB has been involved in the plan design, and we had a very difficult situation recently in terms of reducing the budget by millions of dollars. I see a pretty big fiscal note here, but my specific question is, how does an assembly bill get to this level? I know it starts as a BDR, but what is the history that brings it here? Does it start with a private interest and then go to a lobbyist, and then the lobbyist then works with an assembly person? Am I reading that correctly?
You are right on the money, Mr. Verducci. That's usually, not all bills are that way, but that is a common practice, yes. And before I do go on, I do want to say that this bill is not a shall, it is a may. However, the proposed amendment that will be in this work session on tomorrow, it changes it to May. However, it leaves it open for the board to determine if there is funding available. The problem with that is that's very vague. So is there funding available? Well, you heard that there's definitely funding available right now. We've got excess reserves based on the fact that we had claim suppression. So in that case, does that tie the board's hands into a clinic, or what if the board decided to reinstate certain benefits first? Or what if the board, if there is funding available, what if the board decided to do something else with it first? That language is very vague. And so it would put it in statute, but at that point it's unnecessary because the board already has the ability to proceed with a project like this if it should choose to do so.
Laura, this is Betsy. Just to clarify, the way I'm seeing this is it's saying that PEB would transition from being just a payer of medical services to an actual provider of medical services, totally changing PEB's makeup in a way?
Laura Rich, for the record, yes and no. It really, we would be partnering with a vendor who is, this is what they specialize in. They specialize in setting up on-site or near-site clinics. They would, they would find a location, they would do the staffing, they would essentially run it. PEB would definitely have to oversee it. Built into that fiscal note is additional staff because this would be a very significant duty for someone to take on. So we built in an additional staff that would have clinical expertise that would be able to, oversee this kind of program in an adequate and appropriate manner.
Tom,
Madam
go ahead.
I'm sorry, Tom.
No, Don, go right ahead.
My only question is, or through the chairperson, the financial package is large, and we are already in dollar jeopardy. The biggest thing I question is, do we have the staff that could handle this if it went through?
Laura Rich, for the record, Mr. Bailey, we do not today, and that is built into the fiscal note. We would have to hire additional staff, not just to take on the extra duty, but also to incorporate to have that expertise, the clinical expertise, to be able to oversee something like this.
Okay, but are we not right now short on staff on our general mission?
You are correct. PEB is with all of the solicitations that we have going on right now, and just everything that has been, all of the situations that we've been facing. PEB staff is overwhelmed.
Okay, that's the answer I wanted. Thank you.
So, excuse me, Tom Verducci for the record. So I think we have to be looking at our priorities. We were asked to reduce our budget by $30 million a year plus, eliminate long-term disability, reduce life insurance, increase out-of-pocket maximums, increase deductibles, and now we have a mandated clinic that's going to cost $7 million that's out of the realm of PEB decisions. And it just seems like it's an old school method here of being mandated to put something in place in the middle of a pandemic where we're cutting our budget. So my opinion, I'm staunchly opposed to this one. That's just my opinion.
And Laura Rich, for the record, this the amendment changes the wording from shall to may, which would in turn arguably eliminate the fiscal note, the need for a fiscal note, because it's not mandating the board to pursue a project of this sort. But I would argue at that point that there's no need for legislation because the board already has the ability to move forward with the pilot program should they feel the, the desire to. So unless you're mandating this, there's no point in legislation. That when I testified on this, I made that clear that, it's really, unless you're going to mandate this, the board can already has the authority and the power to move forward, as we were going to in 2017, to move forward with a pilot program of this sort if the money was available.
This is Laura Freed. Mr. Verducci, is that a motion to oppose this bill as introduced, or am I misreading you entirely?
Yes. Now, could I make a motion not to staunchly oppose it, or do we have to stick with just oppose?
You can make any motion you want to make.
Yes, I would like to make a motion to staunchly disapprove.
Oh God, you staunchly disapproval. Okay, I'm sorry to tease you, Mr. Verducci.
No, but I just don't like the whole method here of the plan design being chosen, but through lobbyists and being forced upon us. And we have greater issues that participants are asking us to address and come up with money. And I just don't see the clinic here being forced upon us. So my motion is to staunchly oppose AB 337.
This is
Laura. Second that motion.
Thank you, Mr. Bailey. This is Laura Freed. Just to be clear, is your motion to staunchly oppose SB 337 in all forms, or SB 337 as long as it's mandatory?
In all forms. I just don't like the process.
Okay.
It could have been done differently.
Thank you, sir. All right. So it's been moved and seconded.
Michelle Kelly here. Can I ask Executive Officer Rich a quick question?
You bet.
Executive Officer Rich, has there been a large portion of our population asking for these clinics or for this pilot program? Has there been anyone asking for this pilot program?
For the record, Laura Rich, no. Really, so this would be a primary care clinic, at least, specializing in primary care. It could grow into, to be able to offer other services. But the reality is access issues are not so much in primary care. They're in specialty. They're in, if you try to make an appointment with a neurologist or a dermatologist or, any of those specialists, you're going to wait months to get in. This clinic would not solve that problem. This is primary care, and with maybe some other services built in. But the problem in, the problem Nevada faces in access issues is really around specialty. And we would not be solving that.
This is Betsy. May I ask a question to Laura? So what I think I'm hearing is this is something that we go out and people go see their doc and we pay the claim that has our rate. And now we would be paying for oversight of one of those clinics costing us more money, I'm thinking, than what it does to procure out in the market. That's why there's a fiscal note, because if it was just transferring the pot of money from here to here, I think what it's saying is we're going to pay more money for a similar service with, I'm guessing the conceptual benefit is that it's easier to get in or it's bringing in more doctors. Otherwise, I don't see why we'd pay more money for something we already have when there's other things that we're hoping to be able to refund. But that's just, so I'm trying to understand with this fiscal note, we're taking services we already cover and we're maybe going to have to pay more for them. But the bill sponsor must think there's a benefit, that maybe if you could help us understand what the bill sponsors thinking the benefit is, because you don't usually want to pay some more for something you don't think there's a benefit for.
So Laura Rich, for the record, that's a very good question, Betsy. There are opportunities within these clinics to produce savings. So I'll give you an example. When you go to see your primary care doctor and they order imaging, they send you to whatever location they know of, or maybe they're affiliated with. It may be the most expensive option that is available. And so in this type of situation, we could create steerage. So the doctors in that facility, the physicians, the nursing, the nurse practitioners, those clinicians they would understand the PEB program and only be dealing with the PEB members. And so we would be able to steer folks into high quality, lower cost facilities. Would that bring in enough savings to offset the cost? That's where we were struggling with in 2017 is, there's all these opportunities to bring in savings, but does it really, is it worth the cost that you have to front, especially in implementation costs and, standing up a building and the equipment and staffing and things like that, there's very significant costs. So again, this works out much better when all of your membership and your, the plan participants are in one centralized location, because then you can steer those folks into lower cost services or lower cost options, or, higher quality as well. So you have more control. But in our situation, we don't have the, that population in a very, we don't have a dense population. It's very scattered. And so it doesn't work as well.
Tim Lindley here, if I may, Chair Fried. In 2015, May 2015, I actually have my old records and I was able to find them. In May 2015, in the Grant Sawyer building, the Public Employee Benefits Board held a blood work drive, if that jogs your memory. Do we know the efficiency or how it helped members above and beyond what members typically do? Did it increase activity or participation in the programs?
Laura Rich, for the record. Mr. Lindley, I think what you are referring to was the wellness program that the legislature ended right around that time. I think it was in about 2015. Wellness is a touchy subject when it comes to healthcare. I have read many pieces, many articles about wellness, and there is the argument that if you pour money into wellness, you get it back in lower medical costs. However, there's a lack of concrete evidence to support that. So you can probably find information to support that argument or to not support that argument. Yes, again, there's the more you go and seek preventive care, there's probably a higher chance that you're going to find things earlier and discover any kind of disease at an earlier stage. And so that could potentially drive down the cost. But again, I'm going back to, this is one clinic and our population is scattered. Even if it were 3 or 4 clinics, we don't have the density of, populations. And so we cannot drive folks into those facilities to make a significant enough impact.
I will say from my memory, it didn't necessarily drive some of my coworkers to go attend the wellness event because they prefer their primary care provider instead of a doctor in the lobby of the Grand Soria building. But the general question I guess I had was, did we see an increase in utilization of the wellness benefit because of that, or was it negligible?
That is a good question. I will have to go back. I was not at PEB in 2015, so I will have to go back and look at that. What I do know, though, is that we incentivize primary care with HSA dollars in the last several years. And there was a slight uptick in that utilization of wellness services, but not super significant.
Okay, thank you.
This is Laura Freed. Okay, so board members, any other questions? Okay, I would remind you all that there is a motion on the floor. It's been moved by Mr. Verducci to oppose staunchly oppose Assembly Bill 337, and it was seconded by Mr. Bailey. So unless there's any discussion on the motion, I'm going to ask for all in favor to signify by saying aye or wave your hand in your little Zoom box.
Aye.
Aye. Aye. Any opposed? Nay? Okay, motion carries unanimously. Thank you. And we'll move on.
Okay, Laura Rich for the record. The next one is on page 13. I wanted to touch on AB 348. Again, not a bill that will have a fiscal impact on PEB, but I did want to bring this up because it does add the PEB executive officer onto the Patient Protection Commission as a non-voting ex officio member. So that's really the only impact to PEB. There was a work session yesterday where there was an amendment. There was a lot of stuff in this bill that was not supposed to be in this bill. Particularly everything that was in SB 40 was added also to AB 348. So in that work session, there was an amendment and it kind of cleaned it up a little bit. But really the only thing that would impact PEB here is the just that extra duty of the executive officer being added to the Patient Protection Commission. That was passed out of committee yesterday. So I will stop there for questions.
This is Laura Freed. The only question I have is, Ms. Rich, do you actually have time in your schedule to do this? I mean,
well,
I'm sorry to put you on the spot, but
all of these solicitations are, off the, the radar, maybe when there's no session, when there's no contracts up for bid. It's just one more thing added to my plate. I'm not opposed to it. I think that it makes sense to involve PEB in this group because of just, this group is affecting and analyzing healthcare in the state. And I think that PEB is a valuable resource to that. So I think just being a part of it would be beneficial, regardless of my ability to, stretch thinly. I think it's a benefit.
Okay, thank you.
Okay. So any questions, we're not going to take a stance on this one, I think. Okay. All right. So the next one is, so I'll just touch on SB 40 on page 15, since we did talk about that a little bit last time, and I know there was some discussion, the board took a neutral stance. SB 40 is the bill that deals with the collection of data relating to healthcare and establishing an all payer claims database. Thank you very much, April. She coordinated a meeting with the powers that be that are overseeing this, and was able to answer a lot of my questions regarding this. I personally do not have any concerns. I think that, again, Nevada's not the first state to do this. There's a system in place. There's already existing reporting and formatting and things like that. And so I don't anticipate this being a huge lift for PEB. And I think that this is going to be beneficial in terms of, the goal of transparency within, within healthcare. So I don't have any concerns on that one. And this bill did, it did get amended and passed out of committee. And the amendments were, fairly insignificant. There were some amendments related to confidentiality and things like that, but insignificant to PEB overall. So I will stop there for questions. Doesn't look like it. Okay.
Madam Chair.
Yes, Mr. Bailey.
For the record, John Bailey. Laura, I'd ask you, we don't have a physical note on that. Is that correct?
Laura Rich, for the record, we actually, our fiscal note at the time was cannot be determined, because it's difficult to say whether it's going to come at a cost to PEB, because we didn't know the reporting requirements. As long as it's something standard and, I mean, a claims dump is pretty easy. And this is not something that any of our vendors would really charge much or anything for. So I think we could accomplish this pretty easily, but it's when you start putting restrictions and changing the formatting and the requirements to the way that we're reporting and things like that, that's when it comes with a cost. And so we were not able to determine that, will there be a cost or not? It all depends on what those requirements are going to be when all is said and done. After discussions with staff about this, it turned out that there's not a lot of concern about that. So I think we're okay on the safe side to say there probably won't be a cost associated with this for PEB to be able to comply.
Thank you.
Okay, it looks like we can move on.
All right. Okay, so the next one is on page 17 of 33. It is SB 139. This requires, we talked about this last time, it requires certain health insurance to cover treatment of certain conditions relating to gender dysphoria. I just wanted to provide the board an update on that one. There was an amendment that was it was passed with an amendment on April 2nd. The amendment eliminates voice therapy and adds requirements for individuals under 17 and requires insurers to make reasonable efforts to secure in-network providers. So I want to just discuss a few things. I know that last time there was a concern, why is it that PEB's fiscal note is so much higher than Medicaid's fiscal note? I actually reached out to Medicaid on several of these bills and was part of some work group discussions on this, and it clicked during one of these work group discussions. Medicaid does not have a lot of utilization because they don't have a lot of providers who are who accept Medicaid who provide these services. So that, I think, answered the question as to why PEB's fiscal note was so much higher than Medicaid's. It's because we offer these services, we provide the coverage, but we also have providers that in our network that provide these services. So I do want to say, though, that we will probably be reducing the amount of our fiscal note. I'll be working with our vendors to reduce this because of the amendment and the elimination of voice therapy, along with some other items. I think that we can probably reduce this quite a bit now that the amendment has been added. So I'll stop there for questions.
This is Laura Freed. I have a question. We talked last time about how voice therapy wasn't really expensive for PEB. It was really it was gender reassignment for members under 18 that was really the cost driver of the fiscal note. And so the amendment adds requirements for individuals under 17. So what does that mean for the fiscal note?
This is exactly, Laura Rich, for the record, this is exactly what we're going to have to take back and look at and see exactly, how is that going to affect the fiscal note? I assume that it's going to reduce it. But we haven't gotten that far yet.
Okay. This is Laura Freed again. And the bill as amended still applies to both public insurers, that is PEB and Medicaid, as well as private insurers. Okay, thank you.
Chairperson Freed, I have a question. It's Michelle Kelly here.
Okay, go ahead.
Executive Officer Rich. So thank you for your explanation of how the fiscal notes are put together. And I'm really happy to hear that you're going to relook at this particular fiscal note. I think that that's important. But I am still a little curious. And so I just want to, it's really just a general question. So the only way, for us on the board trying to try to kind of do our job and work out what's what, when I was looking at the fiscal notes, I was curious about the difference between the fertility fiscal note and this fiscal note. And just on the surface, I was like, well, that's kind of odd because, I know a lot of people who've needed fertility treatment. So I just went out and I looked at the CDC and they told me that around 6%, I love this, of married women between the age of 15 and 44, married women, please, suffer from some form of infertility. And then when I went out looking for some form of, representation for gender dysmorphia, the numbers obviously are harder to come by, but I think that I got a number from, bear with me, it's not a great reference, but I believe the Manual of Mental Disorders, the 5th edition, puts the diagnostic statistical at 0.005 to 0.014 of men and 0.002. So well under 1% of the population, well, like not even close to being 1% of the population. And yet we've got a $1 million fiscal note attached to it. And so I'm just kind of like, just at the very top level, I'm confused about that, given that if we then look at the PEB population, we're probably just talking about a couple of people, right? So how can, on the fertility side, where it's 6% of the population, and I understand a lot of the services are already covered, same with this particular category too, though. So can you, there's a question in there somewhere, but can you help?
So, Laura Rich, for the record, you are correct where this is not widely used. There's not a lot of utilization. I think I'll have to go back and look through the emails, but there was just a handful of people. It is every year. It is the cost of those have risen every year, of those services have risen every year since this was introduced in 2015. I think what we were focusing on here is opening the doors to those. So right now for us, it's under the PEB plan, identifies it as you have to be over 18 in order to be covered for these services. So eliminating that requirement does obviously open doors to, to a new population, a new group. So there's a lot of projections. I do think that this was likely when PEB receives the projections or this is what we think might happen, right? And again, that's really what it is, isn't it? It's a best guess using data available to us. We usually get a pretty significant dollar figure, the difference. It could be as low as this or as high as this. And so we try to be as realistic as possible. So I think, we can go back and look at this again. I want to go back and look at this just because of the different requirements in the amendment as passed. But you are correct. The amount of people that have actually gone through this transition and received these services is relatively low, but I think the cost of those services in the grand scheme of things is much higher than fertility treatments. So I think that's where what we're looking at overall is just, the overall cost. And I think Nancy Spinelli, I don't know if she is on, but I know that she's worked very, very closely with our third-party administrator through these, for a lot of these members, because they do go through utilization management and case management for these services. It's a requirement. So I know that she's got a very detailed experience with this, and I don't know if she's on, if maybe she could add to that. Let me see if she's on. I can't tell. Yes, she is. Nancy, are you available? Maybe.
If she's on mute, I just have
I'm sorry. Sorry about that. Yes, we have had a few over the last, I would say the last 3 or 4 years, a few cases where we've had the transgender surgeries. And, but it's, it's only been, actually I can only think offhand of 3, I think. So it's not a real common thing.
Can I ask a follow-up, Executive Officer Rich? I'm just wondering, what is the PEB's annual spend on the services that are currently covered in this category? Is that a number anyone knows?
So I can look it up. Let's see. I remember that this came up in when we were trying to figure out the fiscal note. So if you give me just a minute, if I go through my emails, I can probably come up with it. There's a lot of emails about this. We also have some litigation regarding this too. So I have about 1 million emails on this subject.
Oops.
Let's see. So in 2019, our total spend was $212,000. And in 2020, it went up to 252. 2021, obviously, we've got, so 2020 and 21, that there's a lot of claim suppression. So it's a little uh, that number I wouldn't use as accurate. If we go back, and I don't have it right here in my email, but before 2019, the spend was almost nothing. And so it has been steadily rising. And I think that's where that fiscal note came from.
Okay, well, thank you. I appreciate your answer. I appreciate you looking at that. And it seems to me, hopefully with the amendment, and then if you relook at the fiscal note again, because if we've only been spending $252,000 a year on adults, I mean, I can't imagine there's that many kids under the age of 17 who are lining up for this surgery. You know, it's not that simple. So it just seems that honestly, $1 million seems very high. So hopefully we can bring that down, but I appreciate the information. Thank you so much.
This is Laura. If there are any other questions, we can move on. Oh, Mr. Bailey, I heard you unmute yourself.
Yes, I want to request just a second here, Laura. You said there was legal action taken, and who against?
Mr. Bailey, this is, so there's a, PEB has some litigation regarding, you know, there's appeals and things like that regarding this situation, but it's probably not appropriate to bring it up at this board meeting.
Okay, I understand that. The legality of it. I think that's a good question, because what's that going to cost if it costs us anything? Thank you.
This is Laura Freed. Board members, would you like a 5-minute break? Oh my gosh, this might be the first time in history you guys haven't said yes. All right, we'll keep going.
Jennifer Krupp is talking, but she's muted. Yes.
Okay. All right. Let's come back at 2:25 then, so everybody can have a little break. This is Laura Freed. Is everyone back? Looks that way. All right, so let's resume the meeting.
Okay. So the next one, Laura Rich for the record, the next one that I wanted to go over was on page 18, Senate Bill 171. There's a lot of pieces to this. This bill prohibits a pharmacy benefit manager from requiring a covered person to obtain a drug by mail. Where does this affect PEB? So right now, PEB uses Accredo, which is a specialty pharmacy through Express Scripts. Specialty pharmacy, specialty drugs are usually much more costly and come with a significant rebate. So if this bill were to pass and PEB could not enforce the requirement for members to get their drugs from a specialty pharmacy such as Accredo, and instead could go to a retail pharmacy and receive their specialty drugs there, there could be a significant impact. The impact from that is one, the drug pricing is definitely, the discount we get through Accredo is much, much higher than through a retail pharmacy. So overall at retail, that drug would be a lot more expensive. Secondly, we would not be the rebates that we would get. So the program PEB gets a significant amount of rebates from drugs through our PBM every year. And so a lot of these rebates come from specialty drugs. The rebate would also be much less if that drug were to be purchased at a retail pharmacy rather than through a specialty pharmacy, through the Accredo specialty pharmacy. So PEB worked pretty closely with our PBM, with Express Scripts, to look at, what kind of impact would this have on the program. You have heard members that are unhappy with the requirement to get these specialty drugs through the mail because, especially in Southern Nevada, you have, the summers can get hot. And so having a medication sit out on your front porch in 110-degree weather is, not great. And so most of the time, these folks have to take other measures, which we can accommodate. Express Scripts does, they'll send it to your place of work. They'll, there's different mechanisms to mitigate those issues. But overall, we do have members who prefer to go to retail and pick up their drugs that way. So we looked at how many people do we think would switch over to retail versus mail order. Right now, I think that the amount of folks that are receiving their specialty drugs, they're probably going to stick with that. Not a lot of people are going to switch over. I think that, those that are on that program that they're used to it, they're going to continue to receive their specialty medications that way. It's probably going to be the newer folks that have new prescriptions that move on to that retail option. So we took a look at what do we think the impact would be and how many folks do we think would, move on to get their drugs through retail. And the biannual impact that was provided by Express Scripts was about $637,000. Now, What I do want to add is that there was a conceptual amendment, which was then, it was actually on, when was it? Today. Today, it was the one I listened to this morning, actually. So it was amended and passed this morning. And it included the amendment that definitely changes things for PEB. It would have a much greater impact for PEB than the $637,000 that you're seeing here, because the conceptual amendment will essentially eliminate the ability for PEB to offer the Save On program and out-of-pocket protection program that we have in place. And so if you remember, we put that in place earlier in 2020, I think. I can't remember if it was the May board meeting or the March board meeting, but that was, the board implemented that because of the $2 million a year that we would see in savings. And additionally, the members would see, the members that had those medications that fell under the Save On program would also have a $0 out of pocket. So there were savings both for the member and for the program. This conceptual amendment, or the amendment that was incorporated in this bill and passed today, eliminates PEB's ability to offer those. And so our fiscal note will definitely increase by several $1 million, probably, $4 million is what we're looking at for a fiscal note, on top of the $637,000 that was identified in the original bill. So I have reached out to Senator Hardy and Assemblywoman Hardy as well to discuss the implications of this amendment. It sounds like they have been working with Medicaid on this as well. So I was able to communicate a little bit with Medicaid earlier this morning, and we are possibly exploring some language that would mitigate some of these, the fiscal note that we would be putting on there. So, but at this point, that bill has been passed out of committee with that language incorporated in it. So it is definitely concerning for PEB at this point. So I will stop there for questions.
This is Betsy with a question for Laura. Laura, so if it's a loss for the insurer and a loss for the person, what is the benefit? Why is Senator Hardy asking for this amendment? What do they see as the reason to have it?
So Laura Rich, for the record, Betsy, I don't think you were on the board at the time when we discussed this, but originally, so there's people that receive copay assistance dollars. Those are folks who typically have prescriptions that are high cost prescriptions. And so they get assistance from the manufacturer to pay for those. In the past, what was happening is that, let's say that they got $1,000 in copay assistance dollars. And so they were getting that medication, that drug, for very low cost or even at no cost. And so the manufacturer would assist and provide that copay assistance for that member up through the point where they've met their deductible and now they're getting that drug for free. And so then they have no out-of-pocket costs at that point. And at that point, the drug manufacturer cuts the member off and no longer provides copay assistance because the plan is paying 100%. So you can see that we were not able to leverage those dollars. And so what plans are doing now is providing this, they're implementing these programs where those copay dollars don't get incorporated into your accumulator. So if a drug manufacturer provides $1,000 in copay assistance, it does not lower your deductible. It does not go towards your deductible or out-of-pocket max. So that does not get applied. So we had that in place for a couple years. And then earlier in 2020, we added on the Save On program. And what that does is it helps out the member in a sense, because it still provides the copay dollars that the drug manufacturer is willing to provide to that member. It applies it to the plan, and so those costs go down to the plan overall. And I have ESI on the line that can probably explain it a lot better than I can. It's a very complicated program, and I know when we talked about this, when this was brought to the board, there was a lot of questions about it. But in this, with the Save On program, drugs that fall into the Save On category, which there are a significant amount of drugs that fall into this category, the member is getting it at zero cost regardless. And so we're still able to get the drug manufacturer dollars, but the member isn't paying. It's not going towards their accumulator. That money is not going towards their accumulator. So if they were to go see the doctor, go to the emergency room or anything like that, they still have to meet that deductible. They're not just having those copay dollars bring down and eliminate their deductible, but at least they're getting that drug specifically for zero cost. So that's why we have certain plans in place like that, but not all health insurance plans have that. And so I think that health insurance plans are typically not applying those copay dollars to the out-of-pocket cost of members. And I think this is a mechanism to assist those people because those dollars are not being applied towards a deductible, if that makes sense. And it's a lot more complex than that. So I'm happy, if you want more information on that, I am happy to coordinate and have Express Scripts sit down with you and explain the ins and outs of this program. There's a lot to it and it's very complex.
So this is April Karn for the record, and this question is for Executive Officer Rich. You mentioned that retail pharmacy is more expensive for PEB than specialty farm. I'm just curious to see if there's been any research performed around offering incentives for participants to participate on the specialty farm for the mail order drugs. Are there discounts available or what's out there?
Laura Rich for the record. So, I mean, really the incentive is you're likely getting a better drug price at Accredo versus retail. So right now they are required to get it at Accredo. There is no option to get that drug filled at retail. So that's not even, there's no option for that today. If this were to be implemented, it's something that we could consider. And that's, I mean, just off the top of my head, I think there's some barriers to creating incentives, but it's something that we can look at definitely.
Thank you.
Executive Officer Rich, I just have a process question. So you said that they added the amendment, which made it more expensive for PEBP, and that it was passed out of committee. So where does it go now? When do you update the fiscal note? Like, are you seeing that the legislators are paying attention to the fiscal notes? Like, is it deterring them? Because obviously it's going to turn into another big fiscal note. So I'm just kind of curious.
Laura Rich for the record. Well, they're paying attention because I'm emailing them for sure and putting it on their radar. I have definitely, anything with a significant fiscal note, I have reached out to the sponsor of the bill and said, let's talk. So there's definitely, it is on their radar. So I assume with the fiscal note, this is probably going to, go to a money committee. So now that it's been passed out of the committee. So yes, I believe the way that it works is until it's actually posted in Nellis as an amendment, PEB doesn't have the opportunity to change the fiscal note to address that the amendment that's been incorporated into that legislation.
This is Laura Freed. I can speak to that. No agency, Laura Rich's or mine or anybody else's, has the ability to amend a fiscal note officially per NRS 218D. Fiscal notes are only placed on the as introduced version of a bill. So any subsequent change to a fiscal note is done via testimony.
My comment is wow. So I guess, like, I mean, when I think about this bill, obviously it's been driven because participants or members are having, there's spoilage, right? It's happening in the summer. And I wonder if, I don't even know if friendly amendments could happen, but is there a way, for example, for PEBP to say, all right, well, the specialty medications save us so much money, but we understand there's spoilage, because to be fair, in Las Vegas, it's not 110, it's actually 120. And the number of 120-degree days are expanding every year. I mean, that's the reality, right? My garden tells me that because every year trees are dying because it's getting hotter. So is there a way that PEB could put in place a program itself whereby people could opt just kind of in the extreme hot months, so a third of the year or something, where we can allow them to go to the pharmacy, but the rest of the time we get them to do the mail order, so we capitalize on some costs? I don't know, I'm probably way outside the mandate, but thinking outside the box here on how to satisfy participants, but also keep our costs reasonable.
Laura Rich, for the record, it's definitely something that we can look into. Like I said, though, there's Express Scripts has different options in place. You are able to, you can send it to your workplace. You can send it, to wherever you would like that medication to be sent. And usually, it can be sent overnight. It can be sent, there's different mechanisms to address that. But yes, we can definitely look into, what other options are there.
Okay, with that, are we ready to move to the next? Sounds like it.
Did we want to take a position on that one?
I'm hearing deafening silence from the board, so I guess not.
Okay. Okay. So the next one is way back in the back. Let's see. So the next one is on page 26 of 33, Senate Bill 290. This enacts provisions related to prescription drugs for the treatment of cancer. I will say I do have ESI available here. We have been going back and forth on this, on the fiscal note a lot. Because there's some questions about it. I know that there has been, so this morning, on April 7th, it was amended and passed in committee. And the amendments were really regarding the exemption process and time periods surrounding how long the insurer, in this case, it would be PEB, has to provide an exemption or come up with an exemption. So the concern here is that on a program side, the exemption process falls partially on PEB to oversee. We are required to provide a form and would then need to coordinate with ESI on any exemption related to the step therapy or the removal of step therapy requirements that are in place today for the utilization of cancer drugs for those people in those patients in a step or a stage 3 or 4 cancer. So PEB has reviewed this bill, and like I said, we're still looking at whether the cost is, if we need to reduce the fiscal note on this, or what we believe the projected cost is. But I'm going to pass this to, I don't know if it's Jared or maybe Harris from ESI, so that they can elaborate on this and talk about how the fiscal impact really impacts the program here.
Hey, thanks, Laura. This is Jared McGowan for the record. I also have Joe on as well. He's my partner, the financial analyst that actually ran these numbers for us. And as you said, it's really difficult to project what the fiscal spend here would be. For the fact that we can't necessarily see who the stage 3 or stage 4 cancer patients are. And you have step therapy rules in place. So essentially what that means is these patients already have to go through a process to where when the doctor writes the prescription for a certain cancer medication, that they have to go through and get a lower cost alternative drug first to see if it works prior to moving to a more expensive drug. So this step is already in place. And where it speaks of they can apply for an exemption, and that's already in place as well, meaning if there is a particular instance where a patient either has an interaction with a lower cost alternative, or they've tried it in the past and it hasn't worked, there is already steps in place for the patient to be able to get the drug. So, best case scenario, there could essentially be no fiscal impact here. But worst case scenario, you see it here on page 26. We were estimating about 713,000. And Joe, if you're on, can you estimate, or can you explain exactly how you got to the 713,000? Joe, you may be double muted there. Okay, well, Joe may not chime in there, but based on projected utilization of what we saw with some of the high cost cancer drugs, if there would be to automatically apply exceptions, meaning the step therapy rules would go away, this is the impact that we came to of the 713,000.
It looks like Joe was unmuted. Joe, if you...
Oh, Joe, are you there?
Maybe not.
Okay. Yep, maybe we lost connection. Any questions for me on how we came about this? Like I said, this is a really tough one, just because you don't know exactly how many patients are affected or what particular drugs. But just know that the proper protocol is already in place with the step therapy, and patients already have the ability to appeal the decision. And it just comes with more information required from the doctor in order for them to get a particular drug. But at no point is a cancer patient ever denied a medication.
It's Michelle Kelly here. I have a question for Executive Officer Rich, I guess. I'm just, I don't know how, so it's a trifold question, I guess. How long does step therapy in the plan take? And then I guess my comment along with the question is that when we're talking about stage 3 and 4 cancer, I'm assuming like hours make a difference. And so, so can you kind of reconcile for me the difference between, people seeking urgent attention and then the time it takes to work through the step therapy?
So Laura Rich, for the record, I think I am going to ask the subject matter experts who actually do this, Express Scripts, to speak to that, since they're probably much more well-equipped to answer this than I am.
Yeah, Jared McGowan for the record. So just to reiterate, sorry I had some background noise there. All my kids are home. Your question was around step therapy and exactly the kind of the process behind it, and how long it I guess remains in place. Is that right?
And the time it takes to put through step therapy versus versus the cost of time in treatment, I guess. So for example, I guess what I'm thinking is if a doctor recommends drug X, which is one of the more expensive drugs, right? That's where they go because maybe they've seen that it's more, they've decided clinically that it's more beneficial. But then the health plan says you have to do step therapy. How long do they have to, how many steps do they have to take, I guess, and how long does it take to get onto that medicine that the doctor actually thinks will be the best?
Yeah, no, that's a good question. I mean, ultimately it comes down and depends on the drug. And at no point is this Express Scripts saying that, this is what drugs you have to use, or this is the time you have to use a particular drug before you can move to the next. It's ultimately based on FDA guidelines. So, we're following exactly what the FDA says about all the clinically equivalent drugs that are at a lower cost. And there may be times, especially, you're looking at a cancer patient stage 3 and 4, where there is a step therapy when they go and put in the script. There's a step therapy that comes up that notifies them they need to use a lower alternative first. The doctor can appeal that, or they can put in an exception right there. Now they do have to, come forward with, the exact reasoning behind that. And depending on, case by case scenario, that can get approved. But for the fact of saying, for one particular drug, having to stay on it for, X amount of time, that's all going to vary, based, on each individual drug and the therapy. But, oftentimes if they get in on a drug, say, for example, and they have an allergic reaction or whatever it may be, or it's making them sick, they can cut that drug off right away, go back to the doctor, and that's their reasoning as far as why they can move to the next alternative. So it can be a fairly quick process, but at the same time, for plain cost sake as well, that lower alternative may be a good fit for the patient, and the patient can continue that therapy without having to move to that higher cost. Because frankly, the overall plan cost on a net perspective for PEB is 70% on the specialty side. So, and traditionally what you see book of business is about 50% of your plan cost is driven by about 1% of your population, where in PEB's case, it's 1% of the population driving 70% of the cost. So the specialty medications are the primary driver of that. So anytime, you can move them to a lower cost alternative, it's better. But again, we're keeping in mind that these are cancer patients, and we want to make sure that they have the appropriate medicine at the right time. I hope that answers your question.
Yes, thank you.
So I have a quick question too, but could you please describe how long the appeals generally take from a patient's physician and what criteria is required?
Oftentimes it really depends on the physician on how fast they can move. So, generally within, 24 to 48 hours, it can be approved fairly quickly. But oftentimes, Express Scripts or Accredo's engaged very quickly and responding back to the physician. But where we traditionally see the holdup is the physician's response to Accredo or Express Scripts for the appeal. And so as quickly as they can provide them the information that they need about this particular patient, they can usually get it turned around pretty quickly. So and depending on the urgency of the medication, of course. So, if it's less urgent that they need it right now, the appeal's much quicker versus, they could essentially wait a week.
So what information do you request for an appeal?
Really, it's it's obviously all their, medication records, their medical records, what medical diagnosis or reasoning behind requesting a particular drug that might be covered under step therapy. So essentially, they want to see what have you tried in the past and what is your reasoning for bypassing this lower cost alternative and going to the higher cost drug.
And Jennifer, for the record, thank you for that. And then once that information is gathered, who reviews that information and makes the determination about the step therapy adherence?
Yep. So it's essentially an appeals committee, usually put together by pharmacists and physicians that are a third party administrator, essentially, kind of a non-biased group of people that are able to take all this information and gather it. And again, it's not based on their opinion. It's based on FDA guidelines and what is the reasoning of why they could essentially bypass the step therapy and move on to the higher cost alternative.
Thank you. I don't have any further questions. Again, Jennifer Karp for the record.
Okay, this is Laura Freed. Thank you, board members, for those good questions. I learned things from your questions. Is there an appetite to take a position on this bill? Okay, hearing none, guess we'll move on. Thanks.
Hey, Laura Rich for the record. So the next one is on page 28 of 33. It's Senate Bill 321. I'm only highlighting this because we did add an unsolicited fiscal note to this. This creates the Nevada System of Community Colleges. So basically, it would break up the system of higher education into two separate systems. The reason this caught our eye is because we are in the process of implementing or transitioning to a new enrollment and eligibility system. And so we're very well aware of the cost and the processes that need to occur to ensure that payrolls and enrollment and all this can be integrated with our different pay centers. And so NSHE is definitely one of the larger pay centers today. We have payroll integrations with them. We have there's a lot of the technical requirements that would need to happen on the system of community colleges if that were to take place. And so we reached out to the enrollment and eligibility vendor and asked them to come up with a potential cost to do something like this. And so the impact was $235,000, and that's really the impact would be to incorporate the two systems, the PEB system with the, in this case, the community college payrolls and all of those aspects of integrating for health insurance benefits. So I will stop there. I don't think that there's any hearing. It doesn't look like there's a hearing scheduled. It looks like NSHE put a $10 million fiscal note just for 22-23 on this, and then $20 million for future bienniums. So I don't know if this is going to get any traction. It doesn't. The fact that there's no hearing scheduled tells me that this probably will die on Friday. So I will stop there for questions. Doesn't look like it. Okay. Oh,
hey,
go ahead.
Director Rich, Tim here for the record. The only question I have is the board currently has 2 representatives from NSHE. Does the Nevada System of Community Colleges fall under that representation, or would it be separate?
Laura Rich, for the record, that's actually a very, very good catch, Mr. Lindley. It is they would lose representation for sure, because unless something is, unless changes are made statutorily, there would not be any representation as far as it would be the system, or I guess it would just depend on how that language is changed and what the system of higher education, does that now become the university system and the community college system? I don't know how that language would change, but it definitely would have an impact on on the board makeup and statutes and the representation on there. So should this bill pass, it would probably be something that would need to be addressed.
Thank you.
Okay.
All right, moving on to page 30, Senate Bill 360. So Senate Bill 360 revises the appointment to the Public Employees Benefits Program and Public Employees Retirement System boards. This passed in committee last night. And so I'm just going to go into the amendment that was incorporated into that because it makes some significant changes to the original bill. First of all, PERS is eliminated entirely. So it just now focuses on the PEB board. And it adds appointment requirements for 2 board members who are employees of, or actually, I have the amendment right here. I'm going to read it, and that's probably easier. So it amends as follows. The 2 NSHE professional employee members the 2 NSHE professional employee members are chosen from a list of 5 nominations submitted by the professional organization representing the largest number of professional employees of NSHE. I'm assuming this relates to the next one we're going to talk about, 373, but it would essentially, instead of today, we have the governor who appoints from a list of whoever he wants. This would limit it to the list of 5 nominees that would be submitted by the NSHE professional organization. Additionally, the 2 members retired from public employment would also be nominated in a similar way, where they would receive 5, the governor would receive 5 nominations submitted by the professional organization representing the largest number of retired state employees. So the labor organization affiliated with that. And then also the 2 members who are classified employees from a list of 10 nominations submitted by the labor organization representing the largest number of classified employees in the state. So really what this does is it shifts the appointments to, it limits this to a list of nominees versus giving the governor an open-ended ability to nominate whoever he so pleases, like it is today. So this would affect 6 of our 10 board positions as is written in this amendment today. This again was passed last night and amended and due pass last night in committee. And so with that, I know that there was a lot of public comment on this. I'm going to stop and I'd like to hear what the board members have to say or questions from the board members.
Board members?
Tim here.
Okay.
Read if I may. Tim,
yes, of course.
There was a lot of public comment regarding active classified employees being represented on the board. To that effect, I can say that if you're reading the proposed amendments, the statute 287041, and of course, Brandy Mooneyhan, I encourage you to interject. My understanding is that there are 2 employees in classified service of the state, of which I am one. And I understand that there's another member on the board who represents classified employees.
This is Laura Freed. That's correct. You are one, and Ms. Corin is the other one.
And the reception I received from the public comment seems to imply to me that classified employees are not represented. And 2 out of 10 board members are representing, 20% of the board is representing classified employees. Of course, one of the public comments referenced average earnings of $35,000 to $40,000 per year. And I would say I was one of those. Granted, I don't make much more than that, but I was one of those. I work in the Department of Taxation with a lot of people. I work and I represent those people personally. For example, I have coworkers who are single parents, single individuals, and supporting families on one income. In fact, I'm one of them, supporting my family on one income. And so I feel kind of shunned and shunted or pushed to the side and not being recognized that I do look out for not only myself as a PEB member, but also other classified employees. Based on Mrs. Rich's comments, there's approximately 4 chair board seats, 2 classified and 2 retirees that would go to the largest labor organization. Is that
Yes, that's right. So this is Laura Freed. I'm going to ask Laura Rich to sort of level set the conversation by saying, of the 10 statutory board members under current law, what are each of the seats, excluding me, because I'm on the board by virtue of my position. So of the 9 other board members, would you please tell us, for starters, what those people, who their constituency is theoretically? And I just want to note here that Mr. Lindley has to step away. So we will, but let's keep going anyway. I'm sorry, Mr. Lindley, but we will get back to your questions.
So Laura Rich, for the record, I have pulled up NRS 287.041. So the two members who are professional employees of the Nevada System of Higher Education appointed by the governor upon consideration of any recommendations of organizations that represent employees of the Nevada System of Higher Education. One such member must reside in Northern Nevada, and the other member must reside in Southern Nevada. So that is Ms. Kelly and Ms. Urban.
Right.
We also have 2 members who are retired from public employment, appointed by the governor upon consideration of any recommendations of organizations that represent retired employees. So that today is Ms. Aiello and Mr. Bailey. 2 members who are employees in the classified service of the state, appointed by the governor upon consideration of any recommendations of organizations that represent state employees. That is, as we just said, Mr. Lindley and Ms. Corin.
Right.
1 member who is employed by the state in a managerial capacity and has substantial and demonstrated experience in risk management, group insurance programs, healthcare administration, or employee benefits program appointed by the governor. So, and I forgive me, but I don't know if this one is Ms. Fox or if it is Ms. Krupp. But there's 2 positions here and I don't know which one falls into which. And if either of you know, I would be, please correct me or feel free to jump in.
This is Jennifer Krupp, for the record. I think that's the position I fall under.
Okay. Then we have 2 members who have substantial and demonstrated experience in risk management, group insurance programs, healthcare administration, or employee benefits programs appointed by the governor. So that is Mr. Verducci and also Ms. Fox. And then we also have the director of the Department of Administration who falls under that as well. So those are the 10 positions.
Okay, thank you. All right, 2 professional NSHE, 1 North, 1 South, 2 retirees, 2 classified employees, 1 with substantial experience in risk management or employee benefits or healthcare management, and then 2 with demonstrated experience in healthcare benefits or administration. Okay, and then me. Okay, so this bill, as amended last evening, would, I'm sorry, this is Laura Freed for the record. One of these days I'll get that under as a habit. This bill, as amended, would make the NSHE, the retirees, and the classified employees, so that's 6 positions on the board, required to be appointed from a list submitted by the employee exclusive representative that represents the largest number of employees. Do I have that right?
That is correct.
Okay, so I'm going to add a little bit of context to that. Right now, under current law, there are 11 bargaining units that was authorized by SB 135 from last session. 7 of those units have actually organized. 4 are represented by AFSCME, 1 is represented by the Nevada Police Union, 1 is represented by the Nevada State Law Enforcement Officers Association, and 1 is represented by the Battleborn Firefighters Association. That total number of those 7 organized units is about 6,700 people. Or if you, in rough numbers, of the 18,000 state employees, we have 37% organized and represented by somebody. Then we have 62% unorganized. I would note Mr. Lindley is, as he said, an auditor at the Department of Taxation. His class code actually falls under one of the organized units under current law. It's Unit D, which is professional staff not in healthcare, in case anybody wants to geek out on collective bargaining law in this state. And so I am curious, under the law or under the bill as currently constituted, does that mean that Mr. Lindley and Ms. Conran get kicked off the board because AFSCME gets to determine who they want on the board, even though Mr. Lindley actually has the potential to be a union member, but it's not his fault. Unit D hasn't organized.
Chair Freed, Tim, for the record, thank you for educating me on my bargaining unit. And
there you go.
Question. I'll pass it off to Director Rich.
So Laura Rich, for the record, those are all very good questions. The answer is I don't know. I don't know if that kicks off not just Mr. Lindley, but Mr. Bailey and Ms. Aiello and Ms. Conran. I don't know how that would work.
That's true. Yeah.
It's now in the future, though. Let's say they are allowed to remain on the board and carry out their term. At that point, then I believe that AFSCME would have the authority, should this bill pass as amended, would have the authority to essentially appoint, and I say appoint because it limits it. It limits the appointment to what I would assume would be AFSCME or whatever labor organization. It would limit it to those members of that group. And so right now, I would argue that the governor having the authority and the ability and not limited to a list of 5 people has the ability to, and I know that this is done just from the discussions with the staff on the, the board, the governor's board staff, they vet these members and they look at, what kind of expertise do they come with? What kind of, background do they have? What, are they coming in with a bias? Are they, this is all things that they look at in terms of making an appointment. And so when you limit it now to 5 members, you are greatly reducing the pool of qualified and capable folks that can be on the PEB board. So that's just my 2 cents.
This is Betsy. Can I ask a quick question? I'm sorry.
Betsy, please go ahead.
Are the retired members being put up by the active employee organizations or by the retired employee organization? I think it's RPEN.
Betsy, this is Laura Freed. Do you mean currently or under the bill?
Under the bill.
Okay.
So that's a good question. Chair Freed, do you know what the answer is as far as, does AFSCME represent the retirees? I don't know.
Sorry, I didn't mean to talk over you.
No,
I
go ahead.
apologize. This is Laura Freed. No, not technically, not under NRS 288. They have, you can certainly, any one of us as retirees could certainly join the AFSCME retiree chapter of Local 4041. But so to answer Betsy's question, the way I read the bill, yes, in the sense the employee organization. And that's where the terminology of the bill is confusing, because under current law, exclusive representative for state employees has a very specific statutory definition, whereas these bills we've been talking about 360 and SB 373 talk about professional organizations as distinguished from exclusive representative. So but the way I read the bill, the answer to Betsy's question, I think, is yes, that AFSCME being the largest rep would have that power. And so, and I'd like to, somebody else actually had a question at the same time as Betsy. So please
Michelle
speak up.
Kelly here.
Okay, please go ahead.
I guess I just wanted to clarify something. So it's my reading of the bill that the labor organizations, if you were just to cut it short, that the organizations get to nominate or, nominate 5 people. So right now, the way the professionals of NSHE works is that the Nevada Faculty Alliance is the nominating body. But I can tell you that I'm not a member of the Nevada Faculty Alliance. And so their process has always been to go out and seek the most qualified individuals to be on the board. And, I know that there's a perception that I am, the Nevada Faculty Alliance person, but in fact, I'm representing all of the participants. And as I say, so I was nominated by the Nevada Faculty Alliance, but they don't have a requirement that their representatives be part of the Nevada Faculty Alliance. And it's my understanding that 5 out of 6 haven't been members of the Nevada Faculty Alliance. And so, as I say, my understanding is that that bill says the groups get to nominate. Doesn't mean they have to nominate only from their own members. They can seek the most qualified people, unless I'm totally reading it wrong as well. But also, I just wanted to kind of defend my position because, as I say, I was nominated by the NFA, but I am not a member of the NFA. So I'm not sure if what we're all talking about the same thing.
Marcia Urban for the record. I'm not part of the NFA either, but I was nominated, and I actually, they kind of begged if I would do it because they have a hard time finding nominees. And so I was in, I said yes. I don't know why, but I was nominated and I was chosen. So, and I'm still not part of NFA. Just want to put that out there.
Tim Lindley here. a question I have, of course, Michelle Kelly and Marsha Urban, you are not active members in the labor organization. Is there anything that prohibits or prevents labor organizations from nominating today? Like, is there a reason why this was specifically in law? Because maybe Ms. Moynihan can chime in on that as well.
Brandy Mooneyhan for the record. I'm not super familiar with this bill, but the way I understand it is that right now they can make nominations. They're nominations are encouraged to do it.
This is Laura Freed. Brandy, I think you've frozen up.
Am I moving?
Yeah.
Oh, Brandy, did we
Yes.
lose you?
Can you hear me?
Yes, now I can hear you.
Okay, I apologize. I got to notice that my internet is unstable and it's been fine all day except when I talk apparently. So anyway, what I was saying is I believe this bill, first I want to make the caveat that I am not, I haven't studied it in depth or anything like that, but if I understand it correctly, it limits the nominees that the governor can choose from to a list made by the biggest representative group. Whereas right now, those groups can and do make nominations, but the governor can pick, he doesn't have to choose from that list.
Right. Okay.
So Chair Freed, Tim here.
Yep.
I just remember in the public comment, there was someone stated that out of six nominees, only one was chosen. And I don't see how that justifies changing statute when the governor has the ultimate decision on who is elected or appointed to the board. The one thing that I've gathered from this is the largest labor organization could have potentially 4 representatives on the board representing active and retirees. And Ms. Freed, who is the largest labor organization for actives and retirees?
This is Laura Freed. I can only speak for the actives. Right now, AFSCME is the largest labor organization that is the largest exclusive representative of people with an official EMRB designated exclusive representative. I can't speak for the retirees because that's not, the state doesn't bargain with retirees, So, and that's kind of why I drew out that only 37% of, the state workforce is organized right now under current law. My issue with this is kind of twofold. Number one, the collective bargaining process hasn't matured in my view. We've got SB 373 is asking to add NSHE professional employees, unclassified employees to the collective bargaining statute. Okay, understood. I understand they might want to be a part of that. And so that stands to change, to me, the exclusive representative, where you call it a professional organization or an exclusive representative. If you're joining 288, the state has to bargain with you, right? And so AFSCME might not always be the labor organization that represents the most people. Certainly they would try to be, that would be their aim, but who knows if they'd succeed. And Mr. Lindley, I apologize. I used you as a good example because I know your class code is a member of Unit D. There's no telling what unit, how Unit D might organize. And so this leads me to my second point. You and Ms. Cameron and Ms. Urban, Ms. Kelly, Mr. Bailey, and Mr. Verducci are all fine board members. And the way I read this bill, there's no guarantee that any of you would be allowed to serve out your term. Well, this is where, as the chair, I get a little bit protective of the board. And I say, well, these are fine board members. What's wrong with them? Why is this bill trying to kick these people off in the middle of their terms? And so I just don't feel comfortable with it for that reason.
Chair Freed, Tim Lindley for the record. I also have other questions. What if a board member no longer wants union representation? Of course, Ms. Kelly said that the union, they don't have to be union members, but I don't interpret it that way. I would imagine a labor organization, a union would pick members as part of their benefit pack, as part of their representation. And then what if the largest body, labor organization body, changes over the term? For example, you mentioned that there are 7 labor organizations, firefighters being one of them.
Right.
What if firefighters is the largest body for 6 to 12 months, and then it changes to my designation, it becomes the largest body?
Right. This is
reconcile?
Laura. Sorry, I didn't mean to let you finish your thought, please.
Yeah, how does that reconcile, especially in the middle of a term? Because those labor organizations are going to want their representation on the board. Go ahead.
This is Laura Freed. That's exactly the concern I was trying to articulate. I mean, with the churn, that's what I mean by, I think the collective bargaining process with state workers is not fully mature yet. We're still engaged in negotiations with 2 of the 7 units that have actually organized. We're still doing that. I spend a lot of time doing that. And I agree that I think there might be some, changes in the middle of board members' terms that this bill does not anticipate. And again, I don't want to interrupt the continuity and the accrual of expertise that I think PEB plan participants deserve. Because if you constantly have new board members who don't understand how the plan works, I mean, and then it's hard on the staff, and it, makes board meetings longer, and, you get it with an engaged board like this one is, I get great questions. We consider things conscientiously, and I'm just, it's not that labor organizations wouldn't, send nominees who weren't conscientious, but there's just an expertise and there's a learning curve there. Anyway, that's my thought on that.
Chair Freed, I'm going to also add some more to my comments, because now I'm thinking about the public comment about the disconnect between the public perception that we're in a high chair looking down at active members and making the decisions. How do I know that, there's nothing in the proposed legislation that says, okay, a representative must be representative of the average employee. I would gander that I'm kind of representative of the average employee. I go to work and I meet with my coworkers, single mothers, single people, the full spectrum. And when I had to tell them about 12% budget cuts after the board meeting, I got a lot of flack. And then the 6% budget cuts are like, well, that's not as bad as 12, but I still got flack. Why are you, ruining our benefits? And I've even had a story where a grandmother had to was on the HMO plan for many years, and then she went to the PPO plan and maxed out her deductible less than 30 days into the new plan year. So I hope the labor organizations are paying attention that the average employee is represented. And I do look out for how would this not only affect me, but my coworkers as well, because I work with them and I'm obviously passionate about it, and I will stop right there.
Thank you, Mr. Lindley.
I have a quick question.
This is Laura Freed. I'll let Mr. Verducci go, and since he rang in first, and then I'll get to Ms. Krupp. Thank you.
Sorry about that, Ms. Krupp. I heard here that how this could, and this is Tom Verducci for the record, I read where it affects 2 classified employee positions, but I just heard that it could affect multiple positions, and I don't fully understand it. I mean, maybe there's some more detailed language in the bill, but my question, to Ms. Mooneyham would be what is the intention of this bill? Is it to get greater coverage and representation from the union groups? And and just one other thought I'm reading, there's no fiscal note here, and it's my opinion, this is something we should be neutral on. I just don't see us really taking a position here, and it's affecting board members, and I just kind of think we let it play its course. I don't really support it or oppose it, but I just don't really see us in a position where we should really be supporting or opposing it. I think neutral is the right way to go here. And I just wanted to ask Ms. Mooneyham what really, what's the intention here? So that's my question there.
Brandy Mooneyhan for the record. Honestly, I'm not sure. I haven't followed the bill close enough to know why it was introduced. I imagine it's just to, well, I don't want to speculate on what it's for, but maybe to increase the employee representatives' ability to affect the board. But I am not certain of that.
Yeah, and just to follow up comment, bills change in their language too. I mean, we could have this format right here, and this could be something that has completely different language in it in the future before it's passed, if it is passed. But my suggestion is we stay neutral on it, and with that, I'll conclude my comments there.
So this is, well, I think Ms. Crabb wanted to
right,
speak,
yes.
so yeah.
Yes.
Okay, this is Jennifer Kirk for the record. I just had a quick question. So one of the things I had noticed in the bill, and I'm not sure if anybody on the board or on the panel can clarify this for me, but one of the things that it said in Section 2, Part A of this bill was that that 2 members who are professional employees of the Nevada System of Higher Education. I was just curious what the definition of a professional employee was in previous employers where I had worked. A professional employee was different than an administrative employee. So I wanted some clarification on that to see if that would also further exclude certain populations if there are particular people who work at INSHE that would not be classified as a professional employee. Because again, my concern is that this bill is excluding a large portion of our PEB beneficiaries from actually being able to serve on this board. And I'm not in favor of any legislation that would make a person who is directly impacted by the decisions that we as a board have to make not have representation or the ability to serve.
It's Michelle Kelly here. Chair Freed, I can maybe address that question.
Sure.
So professional employees of INSHE generally are just the salaried full-time folk. You could be a professional who's part-time, but you're salaried. And the other full-time continuing jobs are in the classified system of the state. So kind of that's the division, is classified employees are under all of the rules of the state. And of course, we have many of those at INSHE. And then professionals could be teaching faculty, they could be, they're academics, or they could be administrators, but what they are salaried.
Jennifer Kirk for the record. Thank you for that clarification. And then one other thing that I'll just add on to Mr. Lindley's comments, as we've all been kind of discussing, again, Jennifer Kirk for the record, our intent and our desire to work, for all state employees who are covered under PEB. But, up until 2019, I myself was a classified employee. And fun fact, Ms. Karin actually used to be my supervisor in the classified system. So, a lot of us, really don't fall too far away from what, what everybody wants. I mean, many of us have worked for the state for many, many years, and where we are today is not where we started.
Exactly.
So,
thank you, Ms. Krupp. I would add me too. Just over a year ago, I also was a classified employee. So it's not like a lot of us don't understand what that's like.
Carefree Tim here.
Yes.
After reviewing the information, the potential 4, 5, 6 board representation. Sorry, let me backtrack. It seems like the problem that was perceived was lack of representation for classified employees. And this was someone's position on how to remedy that, both for low wage earning state employees as well. But there might be some disconnect or miscommunication between that. because I'm here and we have Mrs. Kafran, pardon me if I mispronounced that, as representing classified employees. And so I'm not a fan of SB 360 because it does hogtie the processes we currently have. I mean, it does amend classified employees. Well, why didn't they go for retirees? Why didn't they go for the other board member positions? To me, it seems like a very short-sighted proposal.
This is Laura Freed. I have a suggestion. What about the idea of adding a board member? In other words, keeping what we have and suggesting, and I don't mean to give Ms. Rich more work. I think that's the last thing she needs. But, you know, the board has expanded slowly but surely over the years anyway. So in recognition of the ascendance in influence of labor organizations, but also in recognition of the idea that, you know, the composition of the board is sensitive to the needs of all active employees, including the classified ones. What if we added a board member chosen by the governor from the labor organization that represents the largest, or I would say exclusive representative, because that's what's in current law, but we can wordsmith that. The labor organization or exclusive representative that it represents the largest number of state active employees, except that if that labor organization were to change, because people change their exclusive reps, they change their professional organizations based on what the membership wants, the member so appointed would be able to serve out his or her term.
Chair Freed, Tim, for the record, being a 10-member board, I'm all about an odd number. I'm comfortable with that.
Yeah, April Karn, for the record, I too am comfortable with that. And I would just like to go on record that I feel that this bill limits the opportunity for classified employees to participate on the board. I'm not really understanding where it opens up more opportunities.
Okay, thank you. Other thoughts, board members? Yes, Mr. Bailey.
I'll try to make this short, but several years ago, there was a bill passed that the board had to have 2 representatives representing the retirees. I am one of them and have been on board over 7 years. I guess what I'm saying, the way I read this, the retiree representatives will probably be affected. And I understand that, but I don't like the idea of the governor not having the right to pick who he wants on his board. I mean, all of them that I've worked for and be on this board has been very supportive of retirees and classified workers. I also, when I represented the retirees, I also represented the active employees the same, because they are all part of our group. And we got to treat them, all of them, by fairness. I never leaned one way or the other, and my record shows that. In fact, sometimes I voted against the retirees, and they took a stand on that one, and I understand it. But I just don't like this particular bill, because I think it is not going to help this board at all. If you lose 4 members, or you lose 6 members, or you lose only 2, you are hurting the board and you're hurting the staff that has to work for you as board members. So my say is, I'm like Tom, I can stay neutral on this, but we are representing a lot of people, so we got to make the right moves. I don't like the idea of one group dictating, and I call it dictating, to our governor that he has to pick from a list of 10, a list of 5, a list of 4. I don't care what the list is, it's not right. So that's all I got to say. I'm on the record, I hope. And if you need any information, but there is a bill that passed long ago that you have to have 2 retiree representatives. Now, I don't know how that would be affected also. Thank you.
Thank you, Mr. Bailey.
It's Michelle Kelly here. I just a comment. You know, I think that for many of the things that are the BDRs and things that have been introduced, we've indicated that we're neutral on it. To me, this is purely public policy, not really connected to PEVP. But I would like to make the comment that I've made before. And being part of this committee, I do see that everybody is doing the best they can to represent all of our members, you know, and I think that I personally feel that, and I hope that our people watching feel it as well. So I don't think it should be interpreted as a personal attack on any one of us. Maybe I'm just too thick-skinned to see that it's a personal attack, but I don't think it should be. And then my only other comment is that if the governor doesn't like this bill, he can veto it. You know, if it makes its way through the process, it's public policy. If he doesn't like it, he actually has the power to veto. And so he could veto it. And so I think that, you know, that we should probably stay neutral on it. That's my 2 cents.
This is Laura Freed. Okay. Other thoughts? Other board members wish to weigh in? I don't know if Betsy or Marcia or the vice chair wants to share their feelings. It doesn't sound like we have a lot of. I'm sorry, guys.
This is Betsy. I'll weigh in, and I agree with everyone. I feel like everyone on this board really does try to think about all the PEB board members when we make our decisions. But I agree. I believe we should stay neutral on this bill.
And this is Marcia Urban for the record. I think we should say neutral on it as well. I know everybody does the best they can, and you're not going to make everyone happy.
All right, now that my dogs have decided they can stop barking at the UPS man, I think we should probably move on then.
Chair Freed.
Yes.
I did like the idea that was, Tim Lindley for the record. I did like your idea that was presented of adding an 11th board member. Is that something that we would recommend as a motion or something that's expressed through the executive officer?
I think we would probably have to make a motion because we're talking about the board's official position on a matter before the legislature. So yes, is the short answer.
So I mean, motion that we allow an 11th position be created as a reasonable compromise.
Oh, okay. Wow. Okay.
Does that make sense?
Yes, of course it makes sense. So the motion would be suggest that the executive officer suggest to the sponsor then a friendly amendment, adding amending the bill to remove, I think is what you mean, the mandatory list submitted by labor organizations, and suggest adding a 11th board member that the governor would choose from the labor organization representing the largest number of employees. Is that it? Is that it? Or please flesh the idea out a little bit more if I haven't said it right.
Chair Freed, yeah, Tim Lindley for the record. That is the gist of the idea. I would think because the current classified positions and the retiree positions aren't restricted to just, I mean, the labor organizations can make recommendations for those, but to make an 11th position that is required to be from a list of recommended people from the largest labor organization. Whether it's firemen, policemen,
Right.
teachers, etc.
Right. All right. I'll second that. Since I suggested it in the first place, why wouldn't I? Okay. It's been moved and seconded. Does everybody understand the motion and have any questions or discussion on the motion?
So I guess,
Ms. Kelly.
I was just going to ask Jeffrey, does that or Mr. Lindley, so we would stay neutral on the bill, but propose an alternative at the same time? Is that kind of what the motion is?
Member Kelly, I would say propose an alternative, because if we stayed neutral on the bill, then we wouldn't do anything. This is us taking an action. Our position.
Okay.
Yeah, I would agree with that, because what we're suggesting broadens out, I think, in other words, the labor organizations would have a say, but it wouldn't necessarily be potentially 6 seats on the board that they have a say about. They'd get their own seat, if you will.
Well, and Chair Freed, Tim Lindley, for the record, they can still make recommendations for the current positions on the board as well.
Yes, under current law, that would still remain true. And there's nothing that would preclude somebody, for instance, sitting in your seat to be a member of a labor organization also. That has also happened in the past.
So, and Laura Rich, for the record, just to clarify, agencies always go and testify in neutral position anyway. And so really it would just be neutral testimony with the clarification that the board is proposing an amendment to do X, Y, Z. And so we wouldn't really be going up and saying we are, opposed, or it would just be, here's the situation where we're presenting testimony in neutral, but this is what the board has proposed.
Thank you for clarifying.
This is Laura Freed. Any other questions or discussion on that motion? Okay.
Yeah, just to bring the board up to date a little bit, a number of years ago, unfortunately, a long number of years ago, we had a labor representative on the board. And that was sort of what the rule of thumb was. And then he moved on to another job, and that was never replaced. For the record.
Thank you, Mr. Bailey. All right. Then I will call the question. All those in favor of the motion signify by saying aye or raise your hand in your little Zoom box. Aye.
Knock myself off. Hold on.
So, Mr. Bailey, was that an aye or no?
Aye.
Okay. Any opposed, say no.
No.
Okay. All right. So that is Ms. Urban and Ms. Kelly are nays. And Vice Chair Fox, I know you're, sorry. Vice Chair Fox, I know you're on the phone. Did you vote aye or nay?
I voted aye. I'm sorry, I'm driving and I think I'm having some reception problems.
Okay, thank you. Got it.
Tom Verducci, for the record, could you read back the motion? Just want to be clear on what we're voting on.
The motion was to have the PEB director submit an amendment that instead of the bill as it was amended and due passed, add an 11th board member that represents the largest number of that represents the labor organization representing the largest number of employees.
Okay, thank you very much. I'm going to change my vote to that one to no. I just don't feel.
Okay.
Yeah, I'm going to vote no on that.
Okay.
I'm just
Gotcha.
real comfortable with how it reads. So.
Okay. Betsy, did you vote aye or no?
I voted aye, but that
Okay.
amendment also would be removing the current language that's changing the other positions to have the list come from the union, I believe, correct?
Yes.
So that has to be part of the amendment, that we're actually taking the current language away and then adding the amendment to add an 11th position. And then I'm comfortable with yes.
Okay. All right. So that is 1, 2, 3, 4. Sorry, I'm just double counting because, you know, I have trouble with this. 1, 2, 3, 4, 5, 6. Okay, 6-3. The motion does carry. Okay. Well, with that, I guess we'll move on to the next bill.
Chair Freed, if I
Yes,
may
sir.
make a comment.
Yes, sir.
This, by adding an 11th board position, it does mean that a labor organization could potentially hold 5 seats, both with classified, retirees, and the new 11th position.
Yes, that's absolutely true.
Okay. And NCHI, sorry. And maybe NCHI. Yeah, I'll leave it at that. Thank you.
Okay, are we ready to move on? Last one? No, not last one, sorry. So Laura Rich for the record. The next one is on the same page, page 30, starts at the bottom of page 30. Senate Bill 373. This bill provides for collective bargaining by some state employees. You did hear a public comment from the Nevada Faculty Alliance about this. I think that there is definitely a difference between the way that the intent versus how it has been interpreted by those outside of the NFA. But this bill for PEB specifically in section 32 adds collective bargaining into, or health insurance into collective bargaining. So with that, and I know that, but when this was posted, we did not have a fiscal note. We were just made aware of this. And so we did not have a fiscal note available, but I did testify on this, as you heard through public comment. I testified on this last night. There's a very significant, as written, this would have a very significant impact on the Public Employees Benefits Program. One, because we're not equipped to be able to handle staffing wise and expertise to be able to handle collective bargaining within different units, different bargaining units. So this would potentially open the doors, as we have interpreted it, to read, to open the doors to different collective bargaining groups and essentially potentially have the 10, 12, 14 versions of plan design. And so, you've heard throughout the challenges of this last year of how important it was for timing and how much work it is for staff to get one version of plan design. And if things are, if things just don't fall into place timing wise, how significant and how difficult it is for staff involved to be able to communicate it, to implement, things like that. So we are just not equipped to be able to handle more than one variation of that. So that was the first concern. Staffing and expertise are just not there. We'd end up having to, part of that fiscal note, and let me backtrack, our fiscal note is right about $1 million each year based on staffing, having to hire additional staff to be able to handle collective bargaining negotiations. Then there's the component of the IT component of it. We would have to have the system, many different systems built out to be able to track who's in what bargaining unit, to be able to handle different variations of plan design, of rates, of things like that. And so there's definitely a component to that as well. Just having our systems rebuilt to be able to accommodate different bargaining units. And then additionally, we would definitely be using our vendors and the expertise of our vendors at a much more significant rate. I think the board has been very aware of, how much more we have utilized our actuaries and, not just for actuarial analysis, but also for consulting. The amount of work that goes into one plan design versus potentially different bargaining units and what would need to be, come into play for that. So that is the concern. Now I know in discussions with NFA after the fact, that doesn't seem to be the intent of this language, but according to, and Ms. Mooneyhan can weigh in here, our council's interpretations, as well as I know Chair Freed in her day job, also through the Department of Administration, has looked at this through a different lens as well. And that was not the way that it has been interpreted outside of the NFA. So there are some significant concerns to this. PEB is just not equipped to be able to handle something like this at this time. And so it would definitely come at a fiscal cost. The other part of this that we didn't identify it as a specific fiscal cost, but out of negotiations, there's a likelihood that it would come at a cost to the state because the employer contribution would likely need to be increased as a result of those negotiations as well. So there's a lot of factors to this, a lot of components to this. Again, I know that, from public comment and discussions with NFA after the fact, that this does not seem to be where they were headed, but according to what is written in this bill, that is how it was interpreted by, all parties outside of that. So Ms. Mooneyhan, I don't know if you want to just add to those comments as far as, can you confirm our interpretation of this bill as written?
Randy Mooneyhan for the record. I think Ms. Rich, you did a good job of representing. I did read the bill, and I believe some of my colleagues that represent other agencies interpret it similarly, that this, it might not have been the intent, but the way the plain language does seem to open up insurance and healthcare benefits to collective bargaining.
Michelle Kelly here. I have a question, I guess, or just Executive Officer Rich. I'm just wondering, for many of the other items we've talked about, people have talked to you about friendly amendment and you've taken that on board. You've discussed what the new language would be, but it's not actually introduced yet. So I think this feels like it's a similar situation, because I thought in public comment, someone indicated that they were writing the amendment as, right now. And so I guess we've relied on verbal promises for other things about amendments. So I'm asking you kind of what your feeling is on that. We've talked a lot about what the current bill says, not so much about what the amendment is and what it would do.
So Laura Rich for the record, this is actually scheduled for a work session during this meeting. I got a notification stating that this bill is scheduled for work session tomorrow. So it'll be voted on tomorrow. And at that point, because I believe there's such a significant fiscal note on this, it will probably end up in the money committees. So if there is an amendment, then again, like Chair Freed mentioned earlier, there would be testimony, and I would get up and say, this no longer affects PEB if the language were to be, amended appropriately.
Madam Chair, for the record, Don Bailey. Laura, what you're saying is we won't have enough staff to do it, and we don't know what the cost is going to be, correct?
Correct. We know the cost will be significant. We do know that there are identified costs. There's just some unidentified costs that would come with it as well.
And additional staff would be needed, correct?
You are very correct on that one.
And that would include additional salaries to the program, correct?
Correct.
That's all. Thank you.
Chair Freed, Tim Lindley.
Okay.
For the record, as presented, health benefits would be in the collective bargaining agreement. The PEB board, the prerogative of the board is to design, manage the healthcare program for participants and dependents. Does this take us out of that are we no longer obligated with this collective bargaining type of agreement as written? Or do we participate in the collective bargaining agreements as a board? I got a lot of questions, of course, but I'll start with that one. That's to anyone who can answer.
Oh, okay. I wasn't clear. Was that a question to me, or was that a question to Executive Officer Rich? I wasn't sure.
Directed to anyone who can answer. Maybe
okay.
Mooneyhan can weigh in on it.
Okay. I think I'll I'm sorry. I'd be happy to let Ms. Mooneyhan go for it, the legal eagle.
Brandy Mooneyhan for the record. I think that's part of the questions that are still hanging out there. It's, of course, this doesn't make amendments. This bill does not make amendments to NRS 287-043, but it's not clear whether PEB would have to negotiate these changes, but it is clear as it's written now, it does appear that it would affect the plan in terms of if there are changes made, if this does put these benefits subject to collective bargaining, that there would be changes to the program, and it's not entirely clear how that would affect the PEB board's plan design. There would be some overlap. I'm hoping that the amendment might make that, the proposed amendment that's coming might make that more clear.
This is Laura Freed. I'll add to that from the perspective of the department that organizes current collective bargaining efforts under current law. So, right, Ms. Mooneyhan is correct. 287-043 invests in the PEB board the responsibility for plan design. SB 373, as introduced, does not repeal that, and yet makes health insurance, including health insurance, a subject of mandatory bargaining. So the sponsors indicate that they were only thinking about, subsidy percentage, for instance, not plan design, the broad thing. That may very well be, but that's not what the plain language of the bill is. So it sets up this kind of statutory conflict, which was one of our concerns for the Department of Administration. Well, does that mean the PEB board doesn't have a role anymore? And if they do, you're very right. I mean, does that mean the PEB board needs to join the state's negotiating team? And if the PEB board has union members on it, isn't that a conflict So that's, that's a statutory problem. And I will tell you that under current law, and NRS 288, if a collective bargaining agreement conflicts with a statute, the statute prevails except if it's 287 or 284. So in this case, the PEB board would lose its authority due to current law. So that's, and putting on my, I'm really trying not to have my Department of Administration hat on, I have my PEB board chair hat on. And again, I get protective of the board. And this has been, since the board transitioned from the Committee on Benefits to the Public Employees Benefits Program, this has been the board's job. And this feels like they're trying to take away the board's job to me.
Chair Freed, Tim Lindley here for the record. So you said that the intent was for the collective bargaining to negotiate state subsidies as an active employee. Am I correct? Negotiate state subsidies?
Yes, sir, but I received that secondhand, so don't take it to the bank.
Okay. You see how active employees will get a certain subsidy, but then we have other active employees who have carved out a niche for their state subsidy. And if theirs is better than the classified employees, such as myself or Miss April, well, you kind of see where I'm going. I hope I can express that. What about the other active employees?
Yes, I mean, and the point of having an exclusive labor representative is to bargain with management and get things other people don't have, that is exactly what it's for. So yes, it is very possible that they could bargain for a greater subsidization of the total premium. They could bargain for lower deductibles and out-of-pocket max, it goes to Ms. Rich's comments about, the board struggles enough to have one plan design and one rate table. If we have multiple bargaining units and they're all doing different kind of things, I mean, I feel frightened for Ms. Rich and her staff that, about producing several different kinds of rate tables. And yes, there would be, sorry, Laura Freed for the record. And yes, that might introduce, inequities, real or perceived.
Chair Freed, Tim Lindley for the record. There's just a lot more questions I have, and I do understand that there may be some amendments along the way. Yeah, I'll wait till those amendments are presented before I ask many, many more questions.
Board members, I'm not hearing a lot. Thoughts, feelings, questions? Okay, I guess we will just let it ride and see what the work session tomorrow brings. And I'm sure Ms. Rich will report back.
Okay, so Laura Rich for the record, moving on to page 31, looking at SB 378. This bill imposes certain requirements relating to prescription drugs. It requires insurers to provide coverage for prescription drugs to include in half of the plans that provide this coverage, certain limitations to cost. This bill is very problematic, but I'm not going to go into too much detail about it because when I saw this, I thought, oh no, because it is, this would require PEB to basically change everything about all of its plans. As you see, at least half the plans would have to provide certain coverage. We don't provide that coverage. Really, where this is focusing on is, again, specialty medication. You heard earlier from the ESI folks that specialty meds, it is 70% or 1% of members driving 70% of the costs in pharmacy. 70% of those costs are driven by specialty. And so this is really placing a limitation on specialty out-of-pocket costs for members, and would really result in PEB having to revamp all of its plans. So I reached out to the senator on this because I saw that, oh my gosh, this is very problematic and this is going to be a humongous fiscal note. When I reached out to the senator on this, a sponsor, she did indicate that she's already, she received feedback from PEB as well as other stakeholders as well, and that this legislation is likely to not get any traction. Because this has not been scheduled for a meeting, there's nothing that I see on the agenda. I think that this will probably die on Friday. So I don't think that we need to, get into the weeds on this one. But if it does, for some miraculous reason, make its way through, we will be putting a very significant fiscal note on that one. So now is the last one. Moving on to page 32, I just wanted to touch on SB 380. This does not have a fiscal impact on PEB. Really, it's just another one of those continued transparency efforts that the state and really the country, the nation has been looking at, just reporting of data concerning the prices of prescription drugs. This puts reporting requirements on PBMs, but also on health insurers as well. As you know, we get, all of our data would come from the PBM. And so the PBM is already reporting this to begin with. So there's really no fiscal impact to the plan. So that one I'm not really concerned about, but I did want to bring that to the attention of the board. So with that, those are the ones that I wanted to cover. And if there's any other bills that I skipped over or that board members would like to pull and discuss, I am happy to entertain that.
Okay, I'm not hearing anybody, so I think we can probably move on to public comment.
Chair Freed?
Yes.
If I may, I wanted to apologize for my emotion earlier. I feel I got very emotional, at least on my end, and I hope people don't take that as offense. I do recognize that there are various board members here representing their constituents, and I can appreciate that because I also represent my constituents. And so, yeah, I'm calmed down now.
Thank you very much, Mr. Lindley. That's great. I think one of the things I value so much about all of you is that, nobody sits there like a bump on a log. You guys all express your feelings and advocate for your positions. And we do disagree on numerous occasions, but, I have tremendous respect for all of you guys. And I thank you all, but thank you for that, Mr. Lindley.
Chair Freed, can I add one thing before we go to public comment?
You betcha.
So for the board members, just so you are aware, Miss Mooneyhan is leaving us. And so this is her last board meeting. I just wanted to take the opportunity to thank her for all of her expertise and, all of the time and effort that she puts towards PEB. She has been great. I know that, we have a lot of questions. We use our DAG constantly. And, just when she's getting to know health insurance, she's leaving us. So I just wanted to thank her. This will likely be her last board meeting. But congrats and good luck moving forward, Brandy.
Probably why she's leaving.
Yeah, nobody wants to be assigned to PEB in the AG's office. Thank you, Ms. Mooneyhan, for all your service to PEB and to the board. Do you know which of the deputy attorneys general might be replacing you?
Thank you very much for your comments. I don't know yet. I have gotten one of my colleagues is taking over some of the ongoing litigation and threatened litigation But I am still working with my chief to find out who PEP can go to for their questions. So as soon as I know, I will of course let Ms. Rich know.
And we have a meeting about this on Monday. So hopefully I have more information to share on Monday.
Okay. Thank you very much. With that, I think we will turn to our second public comment period.
For those of you who have joined for public comment, your name or the last 4 digits of your phone number will be announced, and you'll be advised that you may now make your comments. Due to time considerations, each caller will be limited to 3 minutes. Caller Carter Bundy, you may now slowly state and spell your name for the record and make your comment.
Thank you. Carter Bundy with AFSCME, CARTER-BUNDY, for the record. I want to thank the board for the discussion about 360. I want to clear up a few things, and I think Member Kelly in particular seemed to capture it accurately, but I want to confirm this. You do not have to be an AFSCME member if AFSCME is the largest employee organization representing classified employees. You do not have to be an AFSCME member to be included in the list from which the governor would make appointments. For the NSHE professionals, to address Member Krupp's question, that's the current law. That group is currently composed of NSHE professionals. We didn't really change much language in this bill. And the same thing applies. You do not have to be, in this case, I believe the Nevada Faculty Alliance is going to be the largest group that represents them. You do not have to be a Nevada Faculty Alliance member in order to be on the list for the governor to make an appointment. The same applies to retirees. And just to clarify, my understanding right now is retired public employees of Nevada, RPEN, has significantly more retirees than any other group, including AFSCME retirees. And you certainly don't have to be an RPEN member. You just need to be a retiree. So we went out of our way to make it as clean and simple as possible, where we're really not changing any of the qualifications to be appointed. We're not changing any of the groups in terms of their representation. So to Member Bailey's question, it does nothing to the 2 retiree spots. There are 2 retiree spots. In terms of people being kicked out, quote unquote, in the middle of a term, the start of the section where this is going to be amended is at NRS 287.041, and under section 1, it says the board consists of 10 members appointed as follows. So that means at the time of appointment, this is who the appointee would be, and then people are serving 4-year terms. So at the time of appointment, if there is a debate, I assume it'll either be resolved by PEB or some other way. But as of right now, I don't think there's much dispute about the largest employee organization for each of NSHE professionals, retirees, and state classified. But I think some of the concerns that Director Freed wisely brought up, we certainly don't want people being turned over every year or two. I don't think that's very much of a concern because, again, we didn't really change much language in this bill. These are the appointments as they are made at the time of the vacancies. So I think there were a lot of concerns brought up. If we had written it the way some people feared, those concerns would have been valid, but I think a fairly plain reading of the bill shows that all we're doing is making sure that groups who represent thousands and thousands of employees are able to choose from any of the people that are in those categories, not their members, not even people in their bargaining units necessarily, in order to try to get the best people in front of the governor to represent the interests of, in our case, state classified employees, and in the case of RPEN retirees and NFA NSHE professionals. Thank you so much for your time.
Caller Kent Irvin, please slowly state and spell your name for the record and make your comment. Madam Chair, that concludes the public comment segment.
PEB staff, would you check again? It seems like Mr. Irvin, I didn't hear anything, and did he get lost in purgatory?
I did have him unmuted and he didn't speak, so sometimes that usually means that they went away or
Oh,
they're speaking, but let me give him one more chance.
okay.
Direction. Caller Kent Irvin, if you're there, can you please slowly state and spell your name for the record and make your comment?
Can you hear me now?
Yes, we can.
Okay, sorry about that. This is Kent Irvin, K-E-N-T-E-R-V-I-N for the Nevada Faculty Alliance. Thank you very much for the discussion today. We wish we had had the opportunity to discuss SB 373 prior to the testimony on the fiscal notes yesterday. I think we really could have cleared up a lot of issues. I'm not a lawyer. I've read the bill and we will ask our own counsel about interpretations, but the mandatory item of negotiation that talks about health insurance says health insurance and other benefits provided by the state professional employer. The state professional employer is defined earlier on as the body that employs professional employees, and for us, that's the Board of Regents. So this would be just the benefits provided by the Board of Regents in our case. And as you know, they are free to provide benefits beyond what is available from PEB, and they do that. So that's the main qualification there. There may be other places in the bill that we can clarify what we mean by that, but certainly PEB is not a state professional employer as defined by the bill. And so they would never be involved in negotiations between the state professional employer and the professional organization that is an exclusive representative. So there would just never be an occasion where PEB itself would have to be doing negotiating with or so forth. But if, there's no use doing this in public, we can have conversations offline and make sure we get the bill to a point where it works for everyone. So thank you very much.
And Madam Chair, I now believe we are concluded with our public comment.
Okay, thank you. With that, it is 4:22 p.m. Thank you again, board members, for your lively participation, and we are adjourned.